Hello, I'm James Artingstall. I'm an clinical oncology registrar working in the Severn Deanery. This was a study that we did with my colleagues Abdul Hamid Mohammed and Professor Mark Beresford in the Royal United Hospital in Bath, and we were looking at the PSMA PET CT results in prostate cancer that's biochemically relapsing after prostatectomy. This is relevant to what's been done. We've already had a talk from Dr. Maniam at the conference today about use of PSMA PET CT, and our study was trying to look at the patterns of anatomical relapse in prostate cancer and what levels the PSMA PET scans were being done at. So whether the PSA value at the time you were scanning the patient determined the results. This is important because we wanted to see whether scanning at really low PSA levels did actually change the management. We had a sense from MDT that perhaps the earlier you do the PSMA PET scan, maybe it's not really changing your management because you're not going to pick up a lot of disease. And so we did a retrospective review of the PSMA PET CTs over about 3.5 years between 2020 and 2024. In total, 37 patients had PSMA PET for biochemical recurrence after prostatectomy, and we found that quite a high proportion of those patients had a positive, sort of genuinely positive scan, not equivocal disease on the PET, 19 out of 37. Of those, the majority of the patients had either disease in the prostate bed or the pelvic lymph nodes, and that means that that's disease that potentially, if the patient's fit enough, we could encompass in a radical radiotherapy field. Quite a few of the patients had a negative scan, and then there were only a small number of patients that had equivocal findings that probably would have been monitored on either PSA or a subsequent PET CT. Most of the patients then went on to have radical radiotherapy for that disease if they were fit enough. However, of course, some patients are going to opt for either surveillance or pursuing hormone therapy to treat their prostate cancer. And so what we found was that PSMA PET gave patients a bit more information with the oncologist to make a choice of what kind of therapy they had. So the majority of patients that ended up receiving radiotherapy had it on the basis of a positive scan and allowed the PSMA PET direct, including the pelvic lymph nodes, in treatment. So we found that even at very low PSA levels, we were picking up disease in the pelvic lymph nodes, and that changed the therapy that was given because we included the pelvic lymph nodes in the radiotherapy field instead of just treating the prostate bed. So I think that was really important. We then saw that if you were to say, well, let's wait until the PSA is 0.4 or 0.6 or 0.8 rather than 0.2, which is the current UK practice, that actually we would start missing patients quite quickly, that fewer patients would have disease picked up. And then that means that we're not going to have the information to make those informed decisions about who we treat. So we found that PSMA PET CT was useful, it changed management, and it picked up disease at really low levels of PSA.